Assalamu alaikum dear doctors. In this video I am discussing about delay walking and this is taken from RCPCH TAS case number 32. Let's read the para. A delay in walking is a common scenario that require a bit of diagnostic detective work of differentiate simple delay in motor skill from something more pathological. Although one of the commonest causes of delay or late walking seen in a pediatric clinic is the benign familial bottom shuffling. Remember, benign condition is familial bottom shuffling. That is commonest cause. The cause suggests something more sinister is at work. We should separate causes into neurological upper and lower. Muscular and orthopedic upper motor neuron lesions include cerebral palsy, whether hemiplegic, diplegic, quadriplegic or dystonic ataxic. So, upper motor neuron are including cerebral palsy, whether these are hemiplegic, diplegic, quadriplegic or dystonic ataxic. Whilst the case history require a difficult birth, cerebral palsy frequently occurs with no history of antenatal or perinatal problems. However, whilst clinical signs take some time to evolve clinically, by 22 months we would expect him to have increased tone and reflexes in the affected limbs and upgoing plantars. Muscle bulk may not be particularly reduced at this younger age, but we would reasonably expect to find his ankles difficult to dorsiflex and for him to have a scissoring gait. Remember, scissoring gait is an important point for diagnosing cerebral palsy, and cerebral palsy is an upper motor neuron lesion due to the stiff legs and crossed adductor. The clinical findings in Jacob do not really fit with this being an upper motor neurons problem. If it were thought upper motor neuron origin, reasonable investigations could include an MRI scan of the brain and also hip X-ray at around 30 months of age to check for dislocation. So, for cerebral palsy, we do the investigation test, that is MRI scan. MRI scan of brain is the investigation choice for cerebral palsy. And X-ray we will do for dislocation, as we know that below 4 months we do ultrasound for DDH and above 4 months we do X-ray of the hip. Now, lower motor neuron lesion. Lower motor neuron lesion can be due to trauma or anatomical disease such as spina bifida or a spinal tumor, or due to a generalized disease such as a spinal muscular atrophy. Spina bifida has declined since the discovery of the value periconceptual folic acid, and antenatal ultrasound has now helped to identify many cases early. So they are telling that spina bifida nowadays it's reduced because we know that spina bifida occur due to folic acid deficiency. Now people are taking folic acid during pregnancy time, and also we can diagnose early by ultrasound. That's why that is now decreased. A spinal lesion would produce a combination of leg weakness and low tone, reduced or absent leg reflexes and muscle wasting, fasciculations which can be seen clinically or on EMG electromyography are a feature of lower motor neuron disease. If the spinal cord or cord roots are involved, you would look carefully for involvement of the sacral nerve roots S1 to S4, as this govern continency and sphincter control. Anal sphincter tone can be assessed by gently pulling apart the buttocks, and anal reflexes by stroking the perianal margin. The upper limbs and rest of the body would be unaffected unless the lesion was much higher, and cervical or thoracic spina bifida is usually clinically more severe than the commoner lumbar type. So we can divide the delay walking like upper motor neuron lesion and lower motor neuron lesion, and upper motor neuron can include cerebral palsy, all the classification involved, and lower motor neuron there is spinal tumor, anatomical disease such as spina bifida and spine tumor. And for cerebral palsy we do MRI of the brain, developmental of dysplasia of hip we do X-ray below 4 months and above 4 months, that is ultrasound. This is all about. And another point is familial bottom shuffler, that is very much commonest cause of delay walking. The delay walking until 18 months. Remember, 18 months, after 18 months it is really a concernable thing. Please do subscribe and share my channel everyone. Thank you.